Hello and welcome to ERNs on Air, the quarterly bonus series of the Eurodis Rare on Air podcast. I am your host, Julian Poulan. In this episode, Ines Hernando, our ERN and Healthcare Director, speaks with Dorica Dan, President of the Romanian Rare Disease National Alliance, and Cesar Hernandez Garcia, a Director General at the Spanish Ministry of Health, who is responsible at the ministry for the NHS Common Service Portfolio and Pharmacy. Together, Dorica and Cesar discuss with Ines how the European Reference Networks, ERNs, can be better integrated into national health systems to benefit the entire rare disease community. Central to the discussion is the JARDIN project, launched earlier this year, which aims to drive this integration by providing recommendations and implementing pilot initiatives in areas such as care pathways, data management, and support for undiagnosed patients.
So hello, Dorica and Cesar, welcome, and many thanks for accepting the invitation to be here with me today.
Hello, and thank you.
Hello, Ines. Thank you very much.
So we have decided to dedicate this last episode of the year to discuss how the European reference networks can be used by the national health systems in each country to improve the care provided to people living with a rare disease. Throughout this year, in the different episodes, we have tried to illustrate the value of the networks. We've tried to showcase how they work, their work around the registries, the work they're doing to develop patient journeys, and also the role they could play to facilitate cross-border healthcare. But what we will discuss today is really the ultimate value of the ERNs, which is how they can improve care at national level. Obviously, the networks cannot do this if national health systems do not build the mechanisms and the bridges to benefit from the knowledge, from the training opportunities, from the research capacities and expertise that is concentrated in these networks. So this is the main objective of the JARDIN project that was launched earlier this year in February. And this is a 3-year European project, a very ambitious one, to help individual countries advance their integration agenda. And it counts with the participation of the 27 countries, EU countries, plus 2 non-EU countries, Norway and Ukraine, and is co-funded by the European Commission and the EU countries themselves. So JARDIN will produce recommendations. It will also implement pilots in a wide range of areas, from national reference networks to data management to care pathways to supporting undiagnosed patients, etc. So I think there's a lot to discuss today. So let me now turn to Dorica and Cesar to get a better grasp of what this project is all about. So my first question to both of you is, what is the first idea that comes to your mind when you think about the objectives of the JARDIN project? Dorica, let's start with you.
So the first idea that comes to my mind when we talk about JARDIN is recommendations for the member states and harmonization of care for patients living with rare disease all over Europe.
Thanks, Dorica. So recommendations and harmonization. Cesar, what's the idea that comes to your mind when you think about the objectives of this project?
Well, my first idea is that we need to organize ourselves at the national level to really be connected with this network. So in the connection and have the proper plugins to really, provide the healthcare to the patients living with rare diseases.
So countries need to organize themselves in order to connect their systems with the ERNs. That's clear. Another thing that is clear with this project is that we really need coordinated multi-stakeholder action to deliver on its goals. So when you talk about organizing ourselves, I wonder whether you are planning or you have already done this, where you are mobilizing all the relevant actors at national level to engage in the project, to think and brainstorm and contribute to develop the models and the mechanisms to connect the health system with national networks. And when I say mobilizing the relevant actors, I'm talking about sitting down with health professionals, with patient representatives, with the regional health authorities and the Ministry of Health to discuss all this.
Yeah, indeed, we have a project that is called Uniques, that came from a hospital that is one of the leaders in rare diseases in Spain, that is Sant Joan de Déu in Barcelona. And they very generously give us the background of the project and the name of the project, Uniques, to extend to all the regions. So what we are building now is a network of 30 centers participating in this network to attend rare diseases. We have started a pilot with 4 rare diseases. But the idea is, okay, have everyone connected around the patient's needs, have a information system that really allows us to be part of a community, involving anyone, so managers, doctors, nurses, for sure patients and patients' organization, at the central level and at the regional level, to really build this network able to put the healthcare to the patients. The idea is, okay, we need to transform our health system into one that is really able to provide the healthcare around any of the facilities where the patients may need that help. So probably you will have a reference center in the top, but everyone that is in charge of the healthcare of the patient will be connected.
Sounds good. Sounds like a good news for the people living in Spain with the rare disease, that you're getting organized into networks and that those networks will interface, or that network, if you wish to call it the Uniques network, will be the interface with the ERNs. Other countries are also working in this line, big countries like Germany. So it's really good news. So Dorica, let's hear about Romania. How's the ministry mobilizing the relevant actors?
In fact, in Romania, Ministry of Health have nominated as a competent authority the emergency hospital in Craiova. And they are partners with National Alliance for Rare Disease and the other actors in the field of rare disease since the very beginning, since the writing the application. We were together in making proposals for Romania. And since the project was approved, we had several meetings online. And we just finished the 3 days meeting of Europlan conference, so-called Europlan, a conference that we continue to organize every year. And this year we dedicated 2 days for the JARDIN project to actually discuss how we can mobilize all the stakeholders to create links at national level and create the networks, national networks. We have already 2 networks, but we need more networks, and we really want to create more networks at national level and involve all the 38 centers of expertise and, of course, the National Alliance for Rare Disease, but also other actors if needed, for instance, for quality assurance to be sure that everything and the objectives of the project are achieved.
That's interesting. It's also interesting what you're talking about, Cesar and Dorica, that it's not just about the expert centers, but also other levels of care that will be somehow interacting or involved in these networks to make sure that there is good care throughout the pathway. Yeah, Dorica?
If I may, I think we discussed yesterday that we should include also for instance, the network of community nurses that are engaged in case management for rare disease patients, which are isolated in a rural area, and we will involve them too. So somehow we will try to solve more problems and connect all the relevant actors.
That's clear. And it looks like Romania is very much involved in JARDIN since the beginning through the Ministry of Health and the National Rare Disease Alliance. So Dorica, another question to you that I have is, you have been involved in the European Reference Network since the very beginning as a patient representative yourself for Prader-Willi. And of course, you're also a very active member of the rare disease community in your own country, in Romania. So fast forward, what would success look like in 2027, specifically for Romania? When I say success, it's success of JARDIN. What's your dream?
My own dream of success at the end of JARDIN would be to have clear pathway for patients. So when a patient is addressing to our helpline, for instance, we know exactly where to send the patient, which is the center that can take care of this patient, or to find out a clear pathway that will reduce the waiting time for the patient. Also, I hope that because of JARDIN project, all the stakeholders will collaborate better and in a streamlined manner in order to have the patient in the center and to provide holistic care for patients, because this is our goal, that the patient should be better cared. Even if there is no treatment, we know what to do to improve the quality of life for the patient. This is the success that I dream for.
Okay. So, you're looking very much in inwards, let's say, to, how this project can change what happens in Romania and how it can improve care in Romania. And Cesar, what opportunities do you or the Ministry of Health see with this project? So how do you think JARDIN could contribute to improve in the long term the care provided to people living with a rare and complex condition in Spain? And let me be very clear here. Even for big countries, at times there is a need to send people abroad. So how can the health system improve the care that is delivered to people living with the more common diseases in Spain? And how can the health system in Spain use the ERNs to, make sure that the people that need to travel actually do travel in a timely manner and get access to care in a timely manner?
Well, first of all, I see an opportunity to generate knowledge on rare diseases. So sharing this knowledge all around Europe, I think, would be definitely probably the most benefiting factor for the patients. Second, I see also an opportunity to reduce the timelines of the patient journey and through diagnosis, through the best treatment option, and so on. Third, I see the opportunity of really organize ourselves at the national level, but also at the EU level, to really have a common system. So if there is anything that is so specific that to gain expertise and to really provide the best service is only needed to be done at one center, concentrate that in a single center. So the outcome of the patients and this long journey will be reduced, and the best health outcome can be, I would say, guaranteed.
Thank you for that, Cesar. So to finalize, let me ask both of you the same question. So clearly our health systems are very different around Europe. So we might not have 27 different models to integrate ERNs into national health systems, but we will have a variety of them. Because even if, EU health systems are in principle built around the same premises of solidarity, as Cesar was now highlighting, equity and universal access, each has its own way to implement or achieve these principles. And of course, they have different types of financing mechanisms. They have different organizational structures. They have different governance arrangements, different health budgets for rare diseases. And JARDIN, this project, is going to produce recommendations that need to work or to be useful for all these very different systems. And that's a big challenge for everyone involved in the project. Everyone involved is kind of conscious of this being one of the main challenges. So do you have any suggestions for, how to address this issue?
I think the best thing with JARDIN is that, of course, we will create recommendations for the member states and we'll harmonize the approach. But also, I think it's very important that we will share best practices and we will learn from each other. That will be very important for each of the member states. But of course, the adaptation of the needs in each member state, because we are so different and the care systems are so different. So it's very important too. So we need to adapt all this recommendation to the needs at national level. And a way to have a better approach in terms of funding and sustaining our services is to have a more holistic view of the system and to promote this integration of services. This will create more sustainable services also. And I think collaboration, respect of all the stakeholders, and cooperation at international level is very important and will produce the change, the system change, in fact, in each member state, but also the adaptation that we need. Because we will learn from each other a lot during this time of implementation, and we will collaborate better.
And Cesar, do you have any suggestions for JARDIN?
Let me be very pragmatical with this. We need to, and Dorica has said already, we need to find the way to really provide the movement of the patients where it's needed, and how to compensate and how to between member states this healthcare provided abroad in other countries. So it's not that you send just the patient, but that you send the patient and you are part of the healthcare system. We have in Spain also a system where once you identify a need that cannot be covered with warranties everywhere, the patient has the right to move. And probably we need to discuss how to establish these rights to move and how we are going to compensate. Because if it's not that you have the right to move, the place where that is going to receive the patient has to accept it without any other objection. So we need to build this network of organizations led by the rights to, we need to accept that maybe in some countries we cannot provide whatever that we need, that the patient has the right to be treated with the best option elsewhere, and that we need to arrange how to pay for that in other countries. And this is not just, should be part of the social commitment that we have with rare diseases. Otherwise, I mean, if this network is just, something for doctors to gain knowledge and experience and to send papers and attend meetings, is not going to work. If we decide to have the network, but then we have barriers or we do not facilitate how to make this move, when will be a failure. So we all need to be committed into this social commitment around the rare diseases.
Brilliant. Thank you. Thank you for that. So I have lots of other questions, but we have a limited amount of time, so I can't go on. So I think that we've listened to very interesting things today. My takeaway is I also have this dream that, as Dorica was saying, after JARDIN, we do have clear pathways for people living with a rare disease, whether it's at national level or cross-border. The right of people living with a rare disease to access healthcare at national level and cross-border quality of care and timely quality of care is already recognized in our legislations. That's there. We just need to implement it. That's the problem that we are having. It's not being implemented. Hopefully, JARDIN will give us the boost and some of the tools that we need to make that a reality. I also take the opportunity to stress what Cesar was saying at the end. The political level needs to be involved in all this, because there are decisions that cannot be taken by clinicians or patient representatives. So that's clear. And let's see if in 3 years' time, maybe we can come back together. Maybe we can review and go back to this interview and see where we are and if we have managed to move the needle. Thank you again. It was really a pleasure to interview both of you, and have a good day. Bye-bye.
Thank you.
Bye-bye. Thank you very much.